That brings us to our third piece, which is, yes, there is a huge variability in drug costs, right? We've got our variability in what Medicare costs, what long-term care costs, now drug costs, right? Different people's prescriptions could be wildly different in how much they cost, but one awesome solution coming our way, ever since they passed the Inflation Reduction Act, I won't go into too many details, but there's the simple fact, as of 2025, they're putting a $2,000 max out of pocket to the client on all drug plans through Medicare. So whether it's an Advantage plan or a drug plan, you can't spend more than $2,000 out of pocket on covered medications. That doesn't include non-covered stuff, but that removes so much variability, because I know that you've seen as well as I, you enter somebody's drugs into Medicare.gov and it says $10,000 a year. That's really scary for somebody. To cap that at $2,000, that's a huge advantage.
Yeah, it's amazing. And, you know, it obviously sounds kind of scary, but we have to let a lot of people know, most people pay $10 to $20 a month for prescriptions.
Yeah, and everything's free.
Yeah, exactly. If you're on high blood pressure medications, if you're on cholesterol medications, if you're on most antidepressants and anti-anxieties, these drugs that have been generic forever, the cost is almost negligible.
Sometimes nothing.
Exactly. And it's fantastic that that's the case, but what people really get hit with are these brand name medications. You see those
diabetic drugs.
Diabetic drugs, exactly. You see these commercials where they're like chrysanthemum, and it's people running through a forest and they're like reading off all these side effects. Those drugs can be hundreds, if not thousands of dollars a year, and it can be super invasive to people because they just get hit with it. You know, they're spending their times taking a couple statins, paying $10 a month, and all of a sudden it's like, boom, an extra $2,000 a year, and you can't budget it because you don't expect it to happen to you or anything like that.
And we live in such an advanced day and age where these medications would actually could save somebody's life or make their life easier to live. It's a hard choice for the patient that says, okay, I could spend $2,000 on this medication a year and live an easier, happier, better life, or I can't afford that. Now I have to suffer with the health issue that caused me to take that drug in the first place. It's definitely it's always been tough looking at the medications for clients and seeing how much some of these drugs cost. But now with that $2,000 out-of-pocket max coming into play in 2025, I mean, $2,000 it's not a lot, but it's surely not a little amount of money. That's a lot of money on a fixed income for $2,000, but at least it stops there. So when we talk about budgeting over a lifetime, at least the worst it could be is $2,000 a year over your lifetime. Right?
Exactly. It's like best case, you pay $100 a year or something close to it. Worst case, it's $2,000, at least it's capped. Something interesting is we're really hopeful this happens. As of us shooting this video, which is July 2023 actually, multiple pharmaceutical companies and the pharmaceutical lobby have sued the federal government in an effort to stop this from getting passed. We obviously hope they all kick rocks and it doesn't go through or anything like that. But our hope is it'll be about a year and a half before this goes into play. Hopefully all the legality will play out by then. This could just be a ploy to stall the bill from passing for an extended amount of time, but our hope is that this passes through and seniors will finally see some relief. And even though it's only 2 or 3 drugs, I believe another part of this plan was that the federal government can start negotiating drug prices. So even though it's just a couple and we're just dipping our toes in the water, that could be a huge step forward for a lot of seniors and older Americans. Yeah,
there are plenty of people who are under 65 on employer insurance or individual marketplace insurance. They come in and say, well, I'm only paying $5 for that diabetes drug, and we have to be the ones to tell them, well, there's a huge deductible up front. You're paying $50 instead of $5, and then you're going to hit this thing called the donut hole and pay $250. Paying $250 a month versus $5 is a huge transition because those private insurers can negotiate drug costs, Medicare cannot. Now you see this huge discrepancy in price that people, they don't expect because they say, well, it's been paying $5 forever. That can't change that much. Yes, it can.
Yeah.
So let's move on to our next piece. We got the first 3, Medicare costs, long-term care costs, drug costs. Here's something that moves away from cost, but definitely brings on something that people are kind of unaware of. When we talk about Medicare supplements or any type of Medicare plan, Advantage supplements, et cetera,